the BELLINI study is well known that the addition of Venetoclax to Bortezomib and Dexamethasone in patients with 1 to 3 prior lines of therapy who've relapsed refractory multiple myeloma can induce quite deep responses. But the real benefit is restricted to patients who have either 11-14 translocation or high levels of BCL2. And unfortunately, it has been demonstrated that patients who do not have these molecular subtypes, in fact, have that the benefit of treatment with Venetoclax is offset by a higher risk of infection, which impacts on overall survival. So going forward, really, Venetoclax in combination with Bortezomib and Dexamethasone will be restricted to patients who have either an 11-14 translocation or high levels of BCL2 expression. So the purpose of this abstract was to take a deeper dive into a little bit more on the biomarker side to see if there were any other biomarkers that could be predictive of better outcome or indeed worse outcome in patients who are receiving Venetoclax therapy in combination with Bortezomib and Dexamethasone. And this concentrated on looking, for example, at the mutational landscape. So it was noted that approximately, I think, 31% or so of patients had a mutation within the MAP kinase pathway. Approximately 6 or 7% of patients had a mutation in P53, and approximately 8% of patients had mutations within BCL2. And in fact, none of these mutations in BCL2, in the MAP kinase pathway, or in P53 on their own were found to have an impact on the effectiveness of Venetoclax and Bortezomib and Dexamethasone combination. However, what was found was that in the small proportion of patients who had a high tumor mutational burden, that in fact, even treatment with Venetoclax did not improve the outcome of these patients. Now, the caveat to all of this is that this is a relatively small number of patients that were within this subgroup. And so it has to be, I think, prospectively, confirmed in much larger patient numbers in the future. I think, though, what all of this does show is that for most patients with an 11-14 translocation or high levels of expression of BCL2, that Venetoclax will provide significant benefit.